Yep, thank you for getting people in the room. Welcome to the Tri-County Planning Body Meeting, July 12th, 2023. I hope we're in the right place. We'll do some introductions and I'll walk through the agenda and we'll
Recording in progress.
Thank you. So let's do intros in the room. If we let's start on the screen. It's Zoe.
Hello, everybody. My name is Zoe Copiano. I am from Community Action, Washington County.
Great, thank you. Chair Smith? Oh, you're on mute.
I am on mute. Hi, Judy Smith, Chair, Clackamas County Commission.
Thank you. Mike?
Hi, Mike Liu, Foodbon Shopping Center. I'm taking the meeting from my car, so I'll probably be off camera for most of it.
Okay, drive safe if you're driving. Monta?
Not driving.
Okay, all right, sitting in the car. We'll put on that air conditioning. Monta?
Yeah, Monta Knudsen, CEO over at Bridges to Change. My preferred pronouns are he, him.
Thank you, Monta. Christina?
Hi, everyone. Christina Palacios, she, her pronouns, and I'm with Housing Oregon.
Great. Ebony, you're messing me up being on the screen, but Ebony, you're on the screen and in person, but jump in.
Hi, Ebony Brown, she, her pronouns. I'm the co-chair of the Tri-County Planning Body, and I work at Greater Good Northwest.
Thank you. Councilor Lewis?
Hi, Christine Lewis, Metro Council District 2. Glad to be here today.
Thank you. Vahid?
Good afternoon, Vahid Brown, he, him pronouns, Clackamas County Housing and Community Development.
Okay, and then I think that's the folks there. Let's move into the room. Matt?
Sure. Matt Chapman, he, his, and I'm the other co-chair.
Great, thank you. Steve?
Hi, Steve Rudman, he, him, member.
Thank you. Mercedes?
Mercedes Elizalde, she, her, Director of Advocacy at Latino Network.
Thank you. Chair Harrington?
Good afternoon, Catherine Harrington, Chair of the Washington County Board of Commissioners.
Great. Then, did I miss any members? I don't think so. Let's go to staff. Patricia, can we start with you?
Sure. Good afternoon, everybody. Patricia Rojas, I use she and her pronouns, Regional Housing Director for Metro. I'm really glad to be with you here in person today. And I would like to welcome a new staff member today, an Associate Regional Planner for our team, Giovanni Bautista. We're really excited for you to join our team. I don't know if you want to say anything. Is this working? No, it's working.
Is it working? It is working. Well, it's a pleasure to be here with you all. My name's Giovanni Bautista. I use he, him, his pronouns, and I am thrilled to be a part of the team, and I'm excited to engage in this important work.
Great, thank you. Yeah, welcome. Good to have you. Let's go, Abby.
Hi, Abby Ahern, I use she, her pronouns, and I am part of the Metro Tri-County Planning Body team.
Thank you. Valeria.
Valeria McWilliam, she, her pronouns, and I'm also part of the Metro team.
Malia, I thought you were in the room, but Malia, I see your name. Oh,
I'm
there
right
you
here.
are. I was like, did I see you?
I don't think I'm on camera, but Malia Dieter, she, her pronouns, Program Assistant for the Housing Department at Metro.
Great, thank you. And then we have a couple guests that can introduce themselves later too, but Susan?
Susan Emmons. I'm co-chair of the Supportive Housing Services Oversight Committee. I'm here to present our annual report to you today, and I use she, her pronouns.
Great, thank you. And I know Nui, your staff and a guest, I guess, today.
Yeah, staff and a guest. Nui Bezer, she, her pronouns. I work at Metro and Supportive Housing Services, mostly supporting the Oversight Committee, and I work closely with Susan. You'll hear from us in a moment.
Thank you. And Yvette, I think you joined since we started introductions. Can you introduce yourself?
Hi, everyone. I'm Yvette Hernandez. I use she and her pronouns, and I am a community member.
Thank you. And Commissioner Jayapal, just in time, if you could introduce yourself.
Perfectly timed. Sushila Jayapal, Multnomah County Commissioner, she, her pronouns.
Great, thank you. My colleague.
Hi, I'm Ariella Dolan. I use she, her pronouns, and I'm with Kearns and West.
Great, and Ben Duncan, he, him pronouns, your facilitator. Did I miss anybody on here today? Okay, well, let's dive in. I'll walk through our agenda and what we hope to accomplish today, and then we'll move into our meeting summary approval. So we're create space for public comment, so if there are folks in the audience who would like to provide public comment today, you can raise your hand now, and when we get to that section, we'll call on you. I'll give some more detail when we get to that part of the agenda. We'll receive staff updates focused on updating on progress towards our regional goals, some staffing updates, and then some follow-up items from previous meetings. We're going to move into, as Susan mentioned, a presentation on the 2022 Supportive Housing Services Annual Report, creating some time for questions and answers then. And then we'll move into closing by focusing on our regional plan template. We'll talk through some categories, how that the chapters would be organized, get some feedback from you all before moving forward, and close this out. And hopefully, not hopefully, we will adjourn by 6 p.m. This evening. We do have, Nicole, can you say hi before we keep moving?
There we go. Hi, everyone. Nicole Larson, she, hers. I am the city liaison at Imago Dei Community and an LCSW.
Great, thank you. Any questions about what we hope to achieve today? Okay, well, let's move forward. So, the co-chairs, we have our June meeting summary. Do you want to lead us through that approval?
Move approval.
So we have a motion by co-chair Matt Chapman to approve our June meeting summary. Do I have a second? Second by our other co-chair, Ebony, thank you. All those in favor say aye or yes, or raise your hand.
Aye.
Any opposition or abstentions? Not seeing any, we'll mark June meeting as approved. We are going to move into public comments, so I would ask, this is a time that if folks would like to offer public comment for the Tri-County Planning Body, if you're in the audience, you can raise your hand. I don't know if we have folks on the phone. I see one hand, so if it's Brianna, we'll promote you to a panelist. I don't see anybody on the phone. If you end up on the phone, you can press *6 to raise your hand. And *9 to come off mute. So Brianna will promote you to a panelist. You'll have 3 minutes to provide public comment. It's not a space for deliberation, but certainly anything you offer, the Tri-County Planning Body can take into consideration. So we'll pass it to you.
Hi, my name is Brianna Flores. I'm actually with SHS program from Multnomah County. I'm standing in place for Yesenia, but I had some issues with the link, so I'm glad I could get in here. But that's all it is. So welcome. I'm happy to be here.
Oh, well, thank you for joining. So maybe I'll reopen it up for if there's folks for public comment. So again, if you're in the audience, please raise your hand. We'll promote you. Last call. Not seeing any. We'll close the public comment period and move into staff updates. Are you kicking us off, Patricia? Thanks.
All right. So I wanted to just provide you all with an update on the department. So the department, as you know, is fairly new. We were established as a department in October. And our portfolio, in addition to SHS, includes the Affordable Housing Bond. And for some context, I think that was a team of 3 when I started in 2021. And needless to say, the work that we're doing now with SHS is much bigger and requires an additional staff, but also structures and infrastructure to support the work that our county partners and city partners in the case, or other jurisdictional partners in the case of the Affordable Housing Bond, are doing every day. And so thank you to Metro Council, who last month approved a budget that will add 22 FTE to our team. And again, our team is here to support our jurisdictional partners in implementing the work. But there's also some connection to what the work that you are doing specifically. For example, we will be adding a few staff, 4 staff plus a manager, to implement or roll out a technical assistance and capacity support team. And so that is in response, first of all, to Councilor Lewis, who named this as an issue, but also to requests that we've gotten from county partners, like how can we be supportive to you as county partners? So we will be adding that staff to provide support to our county partners in getting capacity and technical supports out to organizations doing the good work. Other examples might be like project managers to help out and additional policy staff. So all of the work that we're doing here is policy oriented, and we're going to need some additional staff to help make sure that the plan that you want to create gets created. So that's just a few examples of the FTE that we're going to be providing that have a direct relationship to some of the conversations that are happening here. And again, welcome Giovanni to the team. But we're really excited that we're growing our team and that we're going to be able to better support the work that you're doing and the work that the county partners and our organizations in the community are doing.
Good. I think it's going to go to you, Valeria, but any questions around what Patricia just named? Great. Valeria?
Thanks. So I have a few staff updates. I'll start first with regional goals updates. So we want to establish a practice to come to you every month to provide you with brief updates of the goals, not for the purpose of discussing them, but because we have a calendar to dedicate time to do that in upcoming meetings, but really for the purpose of keeping you in the loop of the work. We're also committed to doing the same with the Oversight Committee as the work for each goal continues to move forward. So I'll start, can you put up the slide, please? I'll start with unit landlord recruitment and retention. Metro has contracted with Focus Strategies to identify areas where regionalization can support existing and future county efforts and submit recommendations. Right now, the consultant, with the support of the county staff and Metro, is starting to identify the stakeholders for an initial round of interviews. The Tri-County Landlord Liaison Work Group, who presented to you last month, will be working with the consultant through the project and also supporting the implementation that results from that work. For coordinated entry, so based on county leadership recommendation, Metro is convening a work group to develop coordination strategies that will support the development of recommendations to achieve this goal. And staff are currently in the process of drafting a contract with a qualified consultant to support this work. Living wage, staff have interviewed and planning to hire a consultant to work on this issue. We can't yet say who this is, but they have both local and national insight into this issue, so we're really excited. Healthcare systems alignment. So over the last few months, Metro and County staff have been meeting bi-weekly with healthcare partners. They've been building shared goals and visions. They've also discussed how the Medicaid waiver might be best administered in the Tri-County region. And there's also been communication with the Oregon Health Authority to pursue a collaborative relationship that allows flexibility for our uniquely positioned region. As stated in the recommendation for these goals from the committee, staff will be coming back to provide a more in-depth update with next steps and timeline at our August meeting, which is within 6 months of when this goal was approved. And for living wage, we have interviewed and planning to hire a consultant to work on this issue. Again, we can't really say who that is, but we're excited to share more at the next meeting. Patricia shared a little bit on how some progress on training assistants and technical assistants, but our department is expanding and will include hiring staff to coordinate regional training structure and opportunities, and the same for technical assistance. And a couple more updates to share with you on member recruitment. So we have received 6 applications for the TCPV. Staff have gone through an initial review just for basic eligibility, and we'll be advancing those applications for a second, more in-depth application review. The racial equity lens, which was discussed at the last meeting. Thank you so much for your feedback during that meeting. We also requested additional feedback through the survey. We didn't receive anything, so the document that you have in your meeting packet is currently the latest version of that. This document is not in its final form. It's just a foundation that we're hoping to build off as we tailor the questions for each of the 6 goals. I think I covered everything. I know there were a couple follow-up questions from the last meeting. One around the active ARLA vouchers in each county. We submitted that information in your email along with the quarterly 3 reports. And there was another few questions around the risk mitigation pool as well. And we've received all the information to be able to share that with you in the next few days.
Any questions on those updates? Yes, Steve.
I'm just curious, looking at the ARLA statistics, it was at the end of Q3. So when is the end of Q4? Just now, right? Just happened. 2:30. Right, so what, we should get in September or so? Is that what we're hoping? To get the data?
July? This is interesting.
That soon?
Q4, August?
August 15th.
Good. Thanks.
We'll be sharing those quarterly reports with you as moving forward.
Any other questions? Jess, you want to say hi? Welcome. Get to borrow a mic. Yeah, there you go.
Good afternoon, all. Jess Larson reporting in from Washington County. Nice to be with you. Sorry for my tardiness.
Yeah, thank you. So I think we're going to pass it on to Susan and Nui. So welcome, and I'll just.
I would like to say something first.
Oh, yeah, sorry,
Before
Chair.
we introduce our next guest, I do want to say there's been a lot of awesome feedback from around the counties on the Oversight Committee's presentations, and I just want to give them some recognition. I really appreciate the work that you all are doing. Really happy to be collaborating more in this next fiscal year. And if you guys need support, we are here, but I just want to take a moment and recognize you all for the hard work that you did, and just know that people definitely recognized it across the Tri-County area.
Thank you, Ebony. No matter how many times I write co-chair introduce, I skip it. So thank you for those kind words. I'll pass it.
Okay, so we're going to do a tag team here, but I'm going to start, and I just say I'm excited and proud to be here today to be presenting our first annual report. Our committee started meeting in October of 2020. And the first thing that we did was introduce ourselves. Many of the people, we have a very diverse group. We have 5 representatives from each county, and then we have elected officials, including Chair Harrington, Commissioner Jayapal, Chair Smith from Clackamas County. And initially we shared our values. What were we hoping to achieve? Why did we even apply to be on this committee? We went through a pretty exhaustive onboarding. And again, what really struck me, as diverse a group as we were, how consistent our shared values were. And that will be reflected as we go through the annual report and our recommendations. So for the first year, we learned our role. In January, February, and March of 2021, we reviewed the local implementation plans of each county and approved them, and then watched the preparation for implementing in the first year. So basically, that's what we did 2021, and then watched the programs begin. And so here today to say, well, what happened in that first year? And then the next slide, actually, is there an agenda slide? It doesn't matter, but okay. I think there was an agenda slide before this, but it's okay, we can skip it. So basically, we're planning a quick and snappy presentation. We would ask you if it would be our preference if you'd hold your questions until the end, and we will have plenty of time for question and answers. So we're just going to do a supportive housing services overview, first year progress and highlights, and then I'm going to present our Oversight Committee's recommendations. And so, is this the first slide? Mm-hmm. Okay, so I'm going to pass it to Nui.
Yeah, thanks, Susan. And for those elected reps from Metro and Multnomah County and Clackamas, you've seen, this is really a repeat of the presentation you've seen, and for Washington County, it's a preview. So hopefully you enjoy this. So what the actual annual report is kind of a regional roll-up that the Oversight Committee prepares based on the county annual reports that they submit each October. I'll go through that process in a little bit, but I just wanted to make sure that was clear. A lot of what the committee was able to write in this report really is because of the hard work of the counties. Our county partners did prepare those very lengthy reports that first year, and that's the bulk of the information that you'll see in the regional report, in addition to the recommendations. I'm going to fly through these first couple slides pretty quickly because I think many here have seen this information before. We know that the core values for this program really revolve around making sure we're coordinating regionally, that we're advancing racial equity, all the things that you all are setting goals around and that we're trying to do collectively together across the region. Next slide, please. Hopefully you've seen this before. We've got some higher level 10-year goals in addition to goals we set each and every year through annual work plans. But these are kind of the top level goals over the course of the 10-year implementation. Next slide, please. Thanks. Just a reminder, the Oversight Committee is different than the Tri-County Planning Body. I know we presented on that before. But really, in its essence, the Oversight Committee is an extension of Metro Council's independent program oversight of the implementation of the SHS measure. So there are some specific responsibility areas for that committee, particularly around overseeing finances, approving the LIPs, as Susan's already mentioned, and with respect to the annual report, it is to read and review those county annual reports that are due each October, and then to go through a process of discussion and creation of a regional annual report. Next slide, please. This is the process that we went through on a timeline for this first year. So again, this annual report that we're presenting on is that first program year, and that program year runs from July 1, 2021 to June 30, 2022. So since we received our reports for the very first time at the end of October, this was also the first time the committee was going through this process together. So there was a lot of kind of building the plane as we flew it, as the committee and staff kind of worked through this process together. But I will say, the committee wasted no time after October, started scheduling additional meetings, and for a few months actually met twice a month to make sure there was enough time to discuss what they were seeing as challenges, opportunities, successes, et cetera, within that first program year. And we just finished up most presentations. We have one more to go in Washington County in 2 weeks. So in terms of just the highest level kind of outcomes we saw in this first year, there were goals set between the 3 counties for placing people into housing, for shelter beds, and then also for eviction prevention. And not necessarily every county set all 3 of these goals, but this is the data that we see rolled up across the region. And we did get pretty close on the goals, I'll just say. And when we're looking at shelter beds, we know that in each county especially in Multnomah County, there are many more beds that came into operation that SHS did not fund. So when you consider that, there's well above 700, but we actually did get close just with the SHS funded beds. And just a call out again for those who maybe haven't heard some of the past presentations we've given. Eviction prevention was way over goal, and that really was thanks to leveraging ARPA funds, and that was primarily happening in Multnomah County, that large number. Next slide, please. Just quickly, a snapshot of the revenue, again, only in this first year. Metro started collecting revenue a little bit before the program actually started in July. And you'll see, as we predicted, taking in funds was very slow in the beginning of the year. It was a new tax. Obviously, taxes are not due until April of the following year, so we expected the collection to be slow in the beginning. And then you'll see as the April due date becomes real, the revenue just shoots up. And we did exceed what we thought we were going to take in that first year. Again, it's a new tax. We made some conservative estimates. We made our best guesses. Our finance people really worked hard to make the best guesses, and we were lucky to receive more than we thought we would. But I will say it's not as much as the measure is meant to be receiving each year once we hit ongoing operations. So we're still in ramp up. And we did get close to ongoing operations, but this is a measure meant to operate at $250 million a year in collections. And you'll see how the money that was collected was distributed to each county. So just quickly, before I turn it over to Susan for recommendations, these are some key highlights of the report itself. Again, these are highlights that the committee wanted to make sure were called out in the report, and then we'll go to challenges in a second. But in terms of highlights, I mean, it really reflects that the three jurisdictions in Metro have really worked together to build or start to build more of a regional system to addressing homelessness and also meeting the goals of the SHS measure. So we know just from the Tri-County Planning Body's creation, we know that regional coordination has been underway in the past and is just we're hitting the gas, and we're doing that even more through committees like this, and as you all set the goals and we do the work. Next slide, please. So we know that there were some challenges. One key challenge was getting enough staff to do the work, and we know that this was a pervasive issue across the nation, especially in Oregon. But we know it's even especially true for jobs in the social services sector. So you all are addressing that via wages. We know that that needs to be addressed through other measures as well, such as enough support and technical assistance training, in addition to the wages. So we did see that play out in the first year, right? Ramping up is difficult when you don't have enough staff to actually do the work. And we did know that we didn't have everything perfect in this first year either. We wanted to make sure that services were able to start happening, programming was able to start, even if we didn't have everything perfect. And so, for example, we didn't have all of our reporting templates in place in the first year. We didn't have all of the data perfectly aligned, but we did kind of work through that in the first year, and you'll start to notice a lot of differences in the second year's reporting. There'll be a lot more detail, and it's way better aligned. So I'm going to pass it over to Susan now. She's going to go through what the committee saw in that, going through that report process.
The quarterly report on program wasn't clearly connected to budget. We'd see an outcome measure, but then we think the budget amount should be right next to it. And again, it's a big responsibility. It's an important part of our oversight committee to have this a review of the fiscal, the financial reporting. And so we had specific, ideas about that. And again, that was one of our recommendations. And we believe that that will be improved as we go forward. So next slide. So recommendation, this was the third recommendation, a recommendation on workforce issues. And again, I think what we hope to emphasize today is even though we're separate bodies and we weren't sitting on you, there's quite a bit of alignment between what you've said for your regional plan and your goals. And again, more appropriately, sitting with you to work on this. But there seems to be a growing consensus in our community of the critical need to provide a livable wage. And again, we can't do this work without the agencies and the providers. They're the engine that makes it work. And so if they can't hire people and retain them and treat them as professionals, this isn't going to happen. So we feel strongly about this. We know this is an issue you're addressing. We also talked about multi-year capacity building investment for service providers. And again, your co-chair, Matt Chapman, shared with me a letter that went from the Portland Business Alliance on this. And thank you. That was really a good letter and a strong letter. And again, seeing that there is this growing understanding in the community. I know it's a complex issue, the how-to get there. I think it's very simple, but I know it's not my job and I'm not the consultant, but I think we could get there. I'm very hopeful about this. So the next slide recommendation for program expansion, cross-sector coordination. And again, we have people from the healthcare field. One of our members, Jeremiah Rigsby, is the Chief of Staff at Care Oregon. And so when issues come up about how are we aligned with behavioral healthcare and healthcare, you know, he talks about the tables he's sitting at. And again, I think this is an issue that you are taking on, that you've talked about. We know that this work is already happening in many spaces, but again, coordinating with behavioral health services systems seems to be crucial and critical to have success with the SHS measure. And then next slide, this is our final recommendation is on data reporting and evaluation. From the very beginning, from our very first meeting in October 2020, I would say it was a universal value of our oversight committee members, the importance of being able to report back to the community, to show outcomes and to show evaluation. Evaluation is also a requirement of year 3. And again, to create a plan to address this, the ongoing regional data alignment, and why data alignment is so important. I'm also hearing providers now talk about people where they use the long-term, the ARLA vouchers in year 1, and they're now seeing people who are past year 1 into year 2, approaching 2 years. And so that's very thrilling to me that we're going to be able to have reports on retention. And again, I think it's wonderful to get those numbers out of who we've housed, but to be able to say that we're maintaining people in housing. There are these wraparound services. There are people who were first approached by an outreach worker camping, and they're now in housing because of an ARLA voucher. And again, what a game changer that is. And so to me, that's going to be very thrilling to report that out and hearing already from organizations that are tracking on that and saying, yeah, we've got people beyond year 1, people who we never thought we would house, and now they're in housing. And so next slide. So finally, you know, transforming lives. Everybody knows I love to tell stories, and I'm not going to take up too much time. But what we tried to emphasize in every presentation we've done, 1,674 people placed in permanent housing the first year. That's amazing, given that you were building new programs, more in the second year. Thousands of lives have been transformed, and the stories are so unique, so individual. And we had a report at our June meeting from the communications team at Metro showing what they're doing already, what they've put on their website, the stories they're tracking, the stories they're telling. And again, very moving stories. I would say all of the people, Washington County, Clackamas County, Multnomah County have come with stories and told us individual stories that we've been so moved by. And I'm going to end my presentation, but I did have, if I can find it in all my notes. Yeah, there was a woman in my neighborhood. I live in Northwest Portland, and I don't drive. I walk a lot. I take public transportation, and often run into people that I've seen around the neighborhood. She'd been homeless for years, and she was housed through our supportive housing services measure. And I, like many of my neighbors in Northwest Portland, we'd seen her. We knew she'd been outside for a while. Told me she was in her apartment, and she shared with me a quote from Maya Angelou that I'd never heard, and I had to write it down because I thought it was so beautiful. And she said this is what encompassed for her, what it meant for her now to be in her own home. And the quote is, "The ache for home lives in all of us, the safe place where we can go as we are and not be questioned." So now we're, I guess, open for your questions.
Well, thank you. Might get a little teary with that last quote. Thank you, Susan. And I'll just say as a little bit of an aside, hopefully folks are seeing the very powerful alignment between the conversations that you all have had and what Susan and Nui just put forward, but also just, I've had the incredible privilege of also facilitating that SHS Oversight Committee, and just again, a testament to the incredible work and the process and the kind of candor and honesty and just courage to have some difficult conversations, but all in service to moving the work forward and reflecting the type of stories that you just described, Susan. So with that, let's open it up for questions, comments, thoughts, reflections. Just open it up to the group. Yes, Mercedes.
I was just wondering if you could say more about what kind of evaluations you are asking for.
That is yet to be determined, Mercedes. It is a really good question because there's system-wide evaluations, there's programmatic evaluations, there's also regional and local county, right? So Metro, I think, still has yet to issue some kind of guidance around that, and we're working together with the counties to kind of figure that piece out, but there's nothing set quite yet as to what the expectations are around the evaluation. There is in the Metro Work Plan a requirement for evaluations to start in year 3, but that's what the language says. So we're working through the interpretation of that right now.
Were you asking that with ideas or recommendations as the group does its work?
Well, no, not really. I think that what was described sounds about right. I would have been worried if it was, I didn't want to offer examples because I was afraid I was going to get an answer of all of that. So I kind of just wanted to hear a unique answer.
That's helpful. Thank you, Mercedes. Manta.
Yeah, thank you. My question is on the communications recommendation. I'm curious if you all are talking about not only communicating the work that's being done, but is there a communication strategy to educate the community of how we got here in the first place? And I say that because I spend a lot of my time talking to community members and explaining the systemic issues that brought us to this point that have been carried over for 50 years. So I'm just curious if that's part of that strategy.
Yeah, that is a very good question, and I think this came up in our presentation to Multnomah County and also to the Metro Council. You know, just to give a little background, I've been associated and working on homeless and housing issues since 1978, but I became the director at Northwest Pilot Project, a nonprofit, in '85 and was there for 31 years. And we tracked very closely on the loss of housing. And so what I try to emphasize, and I think this has to come out in a communication strategy, is this problem has been decades in the making. And the example I used, and Steve Redmond's going to roll his eyes because he's going to say, oh, Susan, that's of the past. But I mean, he was staff. I was the chair of the Housing and Community Development Commission from 1992 to 95. And in 93, we had to do a comprehensive housing affordability strategy update. Every jurisdiction in the country had to do one. In Multnomah County and Portland, we always did an A+ job. We didn't do C to pass. We had the best plan, and they were big, and they often kind of sat on a shelf, in my opinion. And so I asked the staff person, Kathy Briggs, this brilliant planner, if she could do an executive summary of 10 pages and state the problem and state the solution. And in 1993 in Multnomah County, we had a deficit of 10,000 units of rental housing affordable to families and individuals. 10,000 units. We didn't have 10,000 households homeless. They were paying more for their rent. They were doubled up. They were paying 60, 70%. And the price tag to solve that was $500 million. And I was really excited. We had been talking about a housing trust fund. I started running around the community giving talks about it, but like nobody was behind me. Oh no, 500 million is too much. So we blinked. And by 2002, that figure was 20,000 units, just in Multnomah County deficit. By 2011, it was 30,000 units. So again, I think it's very important, and I've offered up to the Metro Communications team to go back and see if we could come up with some of this, a narrative about that. Again, this didn't happen overnight, even though it feels to the community like it didn't. So I think it's very important to get that in a communication strategy.
Manta?
Yeah, thank you for that. There's just multiple issues. The other piece that needs to be part of the conversation is just, Oregon ranks almost dead last to access to care, 50 years, the war on drugs, and, you know, the lack of mental health services, the shutdown of facilities over years. So, you know, when folks look around on the street, they see addictions and mental health and houselessness. And if we're not educating them of how those systems have failed us over years, they have a hard time understanding why can't we just fix this so fast? And opening housing is great, but it's not going to solve the entire issue. Yeah.
Yeah, I completely agree with you.
Yeah, thank you, Mata. I think Steve was smiling. I don't think I saw any eye rolls. Mercedes, hop back in, please.
I think another part of that communication is also, I think a lot of people in our community are under the misconception that folks who experience homelessness, that population of people is like static. It's like the same people all the time. And I think just doing some numbers really quick, we think about how many people who are housed at 1650. That means that tonight, 3 to 4 people who were housed yesterday are not housed today. And that will happen tomorrow and the next day and the next day. And so I think that's something that needs to be clear in our communication, but also perhaps in that cross-sector work, we want the for-profit housing sector, the healthcare sector, the employment sector to show up for folks who are currently experiencing homelessness, but maybe more than anything, we need them to show up for the people who are housed today who will not be housed tomorrow, because the homeless response cannot make up for their failures as well as our own.
Yeah, thank you, Mercedes. Matt?
Yeah. Thanks. First off, I think the report, I want to start by echoing Ebony's comment. I think you guys just did a fantastic job, and this was really, really well done and very well presented as well. One of the things on the communication strategy, which just to pile on, what I'm finding is that the other assumption, kind of building on what Mercedes was saying a little bit, is that there is this group, and as soon as we get these people housed, we're done. And so what I hope the communication strategy will include, and I assume it will, but I think with particular emphasis, is to help people understand the inflow that is going on. And particularly with the dramatic increases in rent and all of that I think we're all familiar with, so I won't belabor it. But we have a tremendous number of people coming into homelessness, and we have a smaller number, as best I can tell. I don't know exactly, and I think we'll find out more as the data become more comprehensive, the number of people that are exiting. And to Mercedes' point, and it's different groups in each side, creating awareness of that, I think, is going to be particularly important, because then we will start, the community will start to understand why we need to focus on things like, how do we help kids who are aging out of foster care? Because I think it's something like half of them wind up homeless, within a couple of months. People just released from incarceration, on and on. There are different paths and approaches, and I think we have to create an awareness in the community about the diversity of the sources of people and the causes for people to get, to become homeless, what sort of things are working, and an appreciation not only for the deficit, which I think is absolutely essential, but also for the diversity and complexity of all that is going on. And that's a hard message. Messages of complexity, in my experience, are not typically well received. And so I would encourage a focus on that and figuring out ways to be able to communicate that effectively and thoroughly.
Yeah, thank you, Matt. Christina?
Yeah, I agree about messaging, especially in the immigrant communities. There is a lot of double ups, 3 families sometimes living in one roof. And in the community, they're not seen as homeless because they're not under a bridge or in a car, but I think trying to get those families their own place, it will help their kids to thrive. So I think that's another way of messaging, like what is homelessness in different communities. Thank you.
Thank you. Abby, were you going to add to jump in?
I just wanted to add, related to Matt and Mercedes' comments about sort of the inflow and outflow among the homeless population, that is something that region-wide, all the counties are looking at through the Built for Zero set of tools and metrics. And so not all counties are at the place where they can fully report that up to Built for Zero standards, but we are on the road, and we recognize that as an important measure.
Yeah, thanks, Abby. Chair Harrington? Oh, were you gonna? No, Ebony just got really excited. Do you want to add to what Abby just said really quick, and then we'll go to you, Chair?
Yes, I do want to say that there have been a number of nonprofits, especially in Washington County, that have received rapid rehousing funds, and those funds have been made available to our outreach providers, and we are able to do some prevention in houselessness there. So we are offering rental assistance and utility assistance and some security around that, and making sure that people are not just set up for 1 month, because often people are back in the same situation the following month. So we're trying to make sure that people are set up for multiple months, and if we can, if it is cheaper to buy them out of their lease so they can move to something more affordable, we're also looking at that as an option as well.
Thanks. Chair Harrington?
I do have a couple of questions, but before I get to that, I want to start with a couple of comments. Well, I should highlight. When this report first came out, I skimmed it and I searched for Washington County. And our presentation will be coming on July 25th. But I read the whole thing cover to cover, and I'm known for tagging pages. This is a good thing. This means I've really interacted with the document, and there are highlights and stars, and I didn't bother with the happy faces because the whole thing would be a happy face. So I'll put this in more elected official terms. I am very proud of and grateful for the Metro Council, Metro staff, and the SHS Oversight Committee for all of the work that has been going into the complete program, the Metro Council sponsoring the Affordable Housing Bond Measure, that whole program that SHS is able to leverage, but as they did so, leaning into the message from CBOs, do the affordable housing first, and we'll follow with the services. Don't do it the other way around. And a new Metro Council leaned into that and sponsored this measure and has grown this program for the betterment of our community and the humans living in it. This is a great report. It's well put together. It reflects the work of the Oversight Committee and the 4 partner governments. Thank you so much. There's a tremendous amount of really thoughtful work and volunteer time that the Oversight Committee has put in, but I want to thank the leadership of the co-chairs, Susan, Kathy Way, as well as Dr. Taylor. You've really pulled it all together and led bravely, patiently, comfortably, and ensured that thoughtful work is happening. Thank you very much. Appreciate it. You'll have to listen to that same message delivered on July 25th to our entire public. So for the 2 questions, I was wondering, on page 30, which is the very last, it's in the glossary of terms, talks about the stabilization reserves, and the target minimum reserve level is equal to 10% of the budgeted amount. Are you tracking that as part of at least the annual review to make sure that we're building on that? I just didn't get a sense for that. And I mean, I was trained well at Metro on oversight committees and the value of them. So I'm relying upon that. That's all.
Ed, did you want to take this one, Patricia? Okay.
So the template that we have for reporting includes all of the reserve funds. It has a regional investment fund, the stabilization and contingency, and there are terms in the IGA for each of those and definitions. So some of them, like the one you mentioned, is 10% of the, budget. And then others are actually rolling over and accumulating over time. So, but yes, we are reporting on that, and so we would see any expenditures in the actuals for those reports.
Great. Well, Jess, I owe you another question that I mentioned on Tuesday and haven't typed up yet. But the other question I have is on page number 3, not numeral 3. And it's under the guiding principles, and I've just figured I'd share it here, TCPB. I don't know if it affects our work or just at the oversight committee, but I figured what the heck, I'd ask it. Lead with racial equity. I feel pretty good about how we're getting going with that, expanding the journey and data coming in. It's the second part, and work towards racial justice. And I feel that now, well, I could go on, but what I'm really interested in is how do we define goals and measures related to that? And I realize it's a guiding principle, but it feels like an opportunity to lean into. And so I look forward to hopefully exploring that with, I'm not a certifiably smart person, I'm just a very interested and curious person who's willing to work hard. So I put that on the list of things I'm willing to learn more about.
Patricia, you want to jump into that?
Yeah, thank you, Chair Harrington, for that comment. I will say that it is a body of work that we will never get there. But it is something that I think we start with naming that this is a goal, and we try to work towards it. And in our Metro Work Plan, in section 5.2, it includes goals that are driven by racial equity and, in my mind, will advance to some extent racial justice, because it is looking at, it explicitly calls out measures and metrics, goals and metrics that look at how are we better serving BIPOC communities? How are we seeing better outcomes? Are we seeing BIPOC organizations better involved in decision-making and crafting?
So, but I think I may be splitting hairs. I am comfortable with racial equity. It's the racial justice part that I'm struggling with, and the power of that word justice.
I see. Yeah.
That I need to figure out better. I have to challenge myself
I appreciate that.
to figure out
I appreciate
better.
that comment. Yeah,
I'm not there yet.
thank you.
Doing the same thing with public safety and justice as well. So I got some work to do.
Thanks for that nuance.
Thank you again.
Likely some shared work, Chair, in how we define that. But, and I think as this group has had that conversation around the equity lens, and that might lend itself to deeper conversations around, there's the goal around equity from an outcome standpoint, and then there's this concept of justice that maybe that's our collective conversation that we have later on, and to think about like how are we embedding this notion of justice as we kind of think about implementing and designing a regional plan. So no answer for today.
I appreciate that hope, that message of hope, but I also know, having been elected for just a 4-year term, that I have to make sure I get it figured out and that I do some good work while I have the opportunity of this job, right? And go from there, so.
Well, thank you.
I think that, for Oversight Committee members, I could speak for a few. I think our notion of racial justice and justice for all is that we have a place for everyone to live. Every single person. And at our very first meeting in October 2020, because I wanted to figure out, well, who are these people I'm serving with? And somebody had asked me to be co-chair. I said, okay, I had no idea what was involved with that. And my first question was, you know, do people around the table believe that in our community, we could end homelessness? We could be the first community, because I believe that. And to me, that doesn't mean that everybody's inside, but that means we have an opportunity for everyone to be inside. I believe that. And I also believe that we have never, I mean, to hear you talking about equity and an equitable wage and that it's come up, we were talking about that for the 31 years that I was at Northwest Pilot Project. So if that could happen, and given that we have quite a number of people of color working in our agency and we don't treat any of them the way they should as professionals, and we aren't giving them a livable wage, to me, that would be a step towards justice in our community. And I think it could happen. I think that we always say, oh, it's very complicated. It's complex. You know, you can't just raise the wages of the people who are getting SHS funds. Yeah, that's true. We can't. Because agencies have county funds, they have state funds, they have federal funds. You can't have a bifurcated system within agencies. That's not equitable. So how do we raise them all? And I think there's an answer to that. And I hope your consultant, I would love to just be a person who would be questioned, because I think there's a formula and I think we can do it. We have never had this amount of resource, but we have to do it collectively. We can't demand, you know, that one county does it or one provider. It has to be across the board.
Susan, you can rest assured we'll tap your ideas.
Yeah, well, you're getting, I agree from Christina in the chat, a all caps, yes, we can from Monta, well said. Ebony, were you responding to that? Or Matt, were you responding? I think you were first.
Ebony.
Are you good? Yeah, but why don't you carry the tune and then I'll go to Matt.
Yeah, I think you're completely right, Susan. This year, we are officially able to provide $60K for entry-level staff across the board. We are also able to provide increases in wages for our middle management, so we didn't have to lose that. But it is possible. I think sometimes we think of things as being impossible, but I think yes, we can make it happen. So we are officially now $60K and everybody gets 100% of their benefits paid, plus a dependent, and we're matching 4% of our 401K. So with a little bit of finagling, it's possible. And I think we just as a collective need to demand more. And I want to publicly thank Patricia because she was telling me a year ago, demand more. Like, what's the worst they could say is no. So now we're here, and I encourage everybody else to do the same.
Yeah, thanks for sharing that example. Let's go, Matt, and then Commissioner Jayapal.
Yeah, so I want to, basically to Chair Harrington's excellent points, a note of, frankly, real strong hope. For the last 5 years, I've been a board member of Children's Institute. And one of the things we did about 3 or so years ago is go through a very, very comprehensive, fundamental, soul-searching redo of, vision, mission, strategic plan, the whole thing. And the reason I mention that is that what I noticed and felt is that because we went with a very strong focus on equity and a realization that equity is a bit more of a status, whereas justice is a bit more of a journey, it became one of the most powerful, invigorating aspects of the exercise that we were going through. So I would encourage us, obviously it's not just Chair Harrington who wants to think through these issues. I want to continue to do so the same. But as we look at our equity lens, and now I wish I'd thought of this at the time, I think one thing we can do is focus the equity lens that we have adopted as TCPB and make sure that we have that energy of that exercise. Because I can attest from my own experience, it can be truly inspiring and also very, very focusing. And I think that's what we want to do.
Yeah, thank you for that, Matt. Commissioner Jayapal?
Thank you all. This has just been such a great discussion. And Chair Harrington, thank you for raising that justice question. I think we use the word a lot, and I don't think we are, often we are not clear on what we mean by it. I loved what you had to say, Matt, about equity as a status and justice as a journey. I have a more prosaic way of describing it. That's very poetic. I think one of the things that occurs to me as I hear Susan, and Susan, I don't know why you didn't have throngs behind you, following you when you said, let's create a trust fund of $500 million, because I think you should have. But I think for me, part of the justice conversation is the systems change that we create in order to arrive at the equity status, right? And so when I think about wages, I'm thinking about that changing wages, creating livable wages, that's justice. That's part of the systems change that it will take to get us to equity. So that's just, that wasn't why I put the tent up, but this has really been a great discussion. A couple of other comments and then a request, I think, of Metro staff. So the comments, I've already thanked you, Susan, when you presented to Multnomah County and Nui. I think this report is just terrific, and I think the way that you summarize where we are is honest and challenging and hopeful all at the same time. And I think we need to be all three of those things. So thank you for that. On data, I think all of us are really struck by the alignment between what the Oversight Committee is recommending and the things that this committee has talked about. And I think when you look at the categories, it's like, yeah, workforce, we got workforce, wages, we got, we focused on those things as well. We had an early conversation here about data, and what we agreed was that it's not a separate strategy, it's something that underlies everything else that we're doing. That said, and you and I have talked about this, Patricia, I do think that I certainly would be interested, and I think the others on this body would be interested in sort of a inventory analysis, something about the data work that's happening, both to address what the Oversight Committee is asking for, because the Oversight Committee, because of its role, is asking for data that will help us evaluate, analyze, stay on top. I think we're all also thinking about data as a way to improve our systems. So it's a different facet of how we use data, and we need to do it all. And so I would love for that to be an agenda item at some point.
Thank you for bringing that around. Is this not on? Thank you for bringing that up. And we are bringing that in August. So more to come.
Oh, that's the meeting I'll miss.
I welcome Mindy. Do you want to say hi?
Hi there. Sorry, I'm late, was on PTO, but got to a screen. So thank you for having me.
Appreciate you being here. And then Zoe, I think you had to leave. I just wanted to offer any space if you had any questions or comments, reflections before you might have to jump off.
Yes, thank you. I had to run. I love this discussion. And like somebody mentioned there, those little steps of the racial equity, that we're naming it, that we are making an effort to be inclusive and to try to hold and lift up those communities. We are on that journey, and we probably will not get the justice that needs to happen, but that's having that goal there. Personally, as an immigrant, I like it.
Great, thank you, Zoe. Nicole?
Well, I will piggyback that I love the discussion, and thank you so much, Susan and Nui, for your presentation. I'm really curious about the cross-sector work as a mental health provider, and in looking at, the report, I saw that Clackamas County added 2 positions that were mental health related, and Washington County 5 housing liaison positions. I'm just curious in what evaluation and data collection you've been doing. Is there money through SHS that is designated to hire people specifically as mental health providers and addiction services support? Or are the goals really to align with those systems and utilize existing providers?
So that might be a question for, I'm looking at you, Jess. Jess and Vahid, I think you're on as well, so maybe it's passing it to you all.
Pardon me. I'd be happy to help answer the question, but I also want to defer to the findings of the annual report. From our perspective in Washington County, it's a combination of approaches. There's the system integration approach. We have a position on our staff that is the housing and health integrator, and this person works in Health and Human Services and the housing department and is building programs, working across health systems and partnerships to create alignment of both funding systems, approaches, and service delivery to our community. Some of that includes medical case conferencing, for example. We have healthcare providers coming and doing by name list case conferencing of folks in our shelters. Some of it is program design, like a transition age youth program that we're preparing for folks coming out of foster care, and working with the Medicaid funding to, and potentially the waiver to fund some of the services to support those youth that will be staying in transitional housing. And then sometimes it's just as simple as creating trainings on harm reduction and working with folks who have active mental health systems or symptoms who are in our shelters, and our shelter workers need training and supports on how to just engage and work with people to be safe and in the program, and also to work towards housing planning and such with them. It's not necessarily providing a funded behavioral health, like a QMHP position, right? Because those are the kinds of positions we want to make sure are funded through our medical, Medicaid funded system. But we can make sure that we're taking the best practices and approaches and aligning our systems so that we are going the distance as the housing system to meet people where they're at and connect them to the healthcare and the resources they need in the health system.
Awesome, thank you, Jess. So Vahid, do you want to kind of speak to the specific investments at Clackamas, and then we'll kind of circle back to SHS and then come around to some of the other cards?
Sure, yeah, it's a great question. It's really critical, and I think it goes back to the observation that Monta made earlier about the kind of the public perception and the reality of the intertwining of all of these issues and these kind of historic underinvestments and failings across many systems, and how there's opportunities to fill some of these gaps and maybe temptations. We have to be very careful and look at opportunities for alignment, and not for one system to step in where another system has failed, or has where the our legislative bodies have failed to adequately resource them. So that aside, our approaches mirror in many cases what Jess just described. So also have a position on our team that is not yet filled, but will be doing the same work of integrating health and housing programming, and more than one position to support that work. We also do fund we fund positions in our behavioral health programming at our health centers division of Health, Housing, and Human Services, Clackamas County, to directly connect their housing case managers and behavioral health specialists that work under the clinical supervision of clinical supervisors within a behavioral health clinic, and connect people directly to like ARLA vouchers and housing services, people who are accessing mental and behavioral health services through our clinical system. We also have, in the context of our spend down plan, which we've articulated to our board of commissioners and was approved by them last month, with respect to the carryover dollars that we're all having to plan for, to invest in the physical infrastructure, build infrastructure for addiction and recovery related programming that is focused on serving people experiencing homelessness or at risk of experiencing homelessness. So like what Jess said, it's a mix of things, integrating within our department where we do have, we are, the mental health, authority of the county. The Health, Housing, and Human Services we are a federally qualified health center, but we're also the administrator of the Homelessness Response Network. So we're able to use our department's heft in all those different areas to integrate within and integrate without, for example, with state funding for built infrastructure to address the needs of folks who are the so-called aid and assist population, that for which there's that much written about in the press backlog at the state hospital, providing local alternatives to provide transition spaces for folks who would be on waiting lists for the state hospital, coupling the investments from those behavioral health dollars approved by the legislature with SHS funding, so that folks who are aid and assist population, folks who are experiencing homelessness, who would be entering homelessness if they exited a residential facility, are wrapped around by the housing system, and so we're coordinated, and so it's not, hey, our system has done what we can, now they're homeless. Can you pick up the pieces? It's we're together in the same programming, and we're blending funding to make that a reality.
Awesome, thank you, Fahid. Were you going to add, Patricia? Yeah.
Yeah, thank you. Hello?
Yep.
So as you heard, yes, every county is implementing some level of behavioral health investments through their programming, and it's different in every county. And I just wanted to note that there are significant gaps in the behavioral health system that our system will not fix. And it's not, we won't be able to bring on, SBMI clinicians, right? So I think I want to just make a note of that, because they are different systems, they are different areas of expertise, and honestly, in our populations that we serve, there are different presenting needs. Right, so the presenting need of someone who is experiencing a behavioral health crisis and happens to be experiencing homelessness at the same time, right? So it's easy for folks to conflate these two things, but they are very different, and we definitely need our behavioral health partners, our health system partners, to lean in on this work with us. And that's where, to Jess's point, I am very excited about the Medicaid waiver opportunities at hand.
Thanks, Patricia. And then I didn't know, Susan, did you want to add anything else about just kind of the cross-sector conversations?
I was going to say the same thing that Patricia just said, that, and this has come up a lot in our oversight committee members, that this measure was never meant to fix the mental health system, and how it's been eroded and defunded, and but on the same hand, permanent supportive housing and supportive housing services, I think what we see playing out is there are people in these organizations who have a background in mental health. And so they are getting people housed. They know how to, in some cases, access mental health services. And so that's happening. But again, yeah, there's a great need, and this measure was never meant to fix the mental health system.
Thanks. And I mean, for folks in the room, just you added a comment just recognizing that there's contractual flexibility as well. Do you want to just speak to that really quickly?
Yes, I was just adding on to what Jess said. I think she may have missed or undersold, but we've been able to put in our request for proposals for mental health supports, whether that be staff for sheltering or even just funding for support. So in our navigation retention, we do have some funds set up for counseling, whether that be organizational therapy or any other types of therapy. We do have some funds set up for that. That is kind of navigated with our behavioral health team. So there have been other opportunities.
That's good. Thanks, Ebony. Steve?
Yeah, I think it's a really good discussion today. Susan, you're just as irrepressible now as you were 30 years ago. No doubt. And clearly, part of the communication strategy has to be to clone you, I think. Mm-hmm. But, and I'm really excited that that was a major recommendation. We all know, because we all have friends. People are perplexed about why, haven't we put money into this? How come it's not solved yet? Understanding how we got here and the multifaceted nature is so important. So important, because I feel like the glass is half full, almost half full. I would hope that we have this meeting next year, it would be like 3/4 full. Particularly when the Medicaid waiver comes, we could do things in this community that no other community can, because we actually have resources. And the second part, so I think communication is absolutely essential. I think Metro is rolling on this, and hopefully very soon we'll get some announcements, yes?
Yes.
Good. All right, and then the second one has to deal with more what Jess brought up. And I feel like we talk about systems integration and systems alignment. Everybody talks about it. And everybody says, well, you should do this with this other system. Well, we can't replicate the behavioral health systems. We're not going to be able to do it. but there is this gray area. It's this functions of work who literally find that their job is, how do we better align? How do we better integrate? It's a person's FTE. It's a job description that SHS can provide because it is new money into our community. It is absolutely essential because we have to think about the whole person, right? So I just feel like this is an area that we might have the ability to go way further than most communities, to really think, what does systems alignment and integration look like? And how do we break down some silos and kind of do our work differently? So I'm pretty excited. I want to be more excited next year.
Yes, thank you for that. Let's go Mindy, and then Jess, I'll come to you.
Thanks. This is a fantastic conversation. I want to maybe add a couple of things. Much of the workforce stuff that we have been talking about in housing is also the same in the behavioral health system. And there are lots of tables, not quite like this one, but working on that set of issues. So my hope, I feel hopeful about progress being made there as well, so that as we work to rebuild these two parts of the system, maybe we come up with a better one that serves people on the other side of this rebuilding. The other thing, I've heard a couple mentions of the 1115 waiver. And I have to say, I'm really excited about the work that the integration teams are doing as a result of some of this work. I frankly don't think we need to wait for the 1115 waiver to do much of that work. The idea that the Medicaid system can pay for behavioral health services, if that needs to shift from a fee-for-service to a more value-based payment way, like we have all of those levers to do that integration work now. So I do think the waiver is exciting and gives us a chance to pay for more short-term housing supports, but the work to integrate the systems to better serve the people that both systems are serving in a way that's more holistic and that can just pay the providers for doing the services where they happen, no matter if it's a Medicaid covered service or a SHS covered service. I think the opportunity is there and right in front of us now.
Awesome, thank you, Mindy. So let's go, Jess, and then I'm going to move us on.
I'll be very brief, just to echo and give kudos to Mindy and her team. Her staff met with our staff recently about the Heartwood Commons. Many of you were there to help celebrate the brand opening, but also know this is our first all PSH project. We have a behavioral health provider who's being funded with SHS services to provide behavioral health care to the residents, and Mindy and her staff are helping to untangle and explore how could we use Medicaid resources to fund these behavioral health services in PSH so that our SHS services funding can go even further and create more PSH. So there's a great example underway right now in our community.
Good, thank you, Jess. With that, unless there's any burning comments, I'm going to move us. So thank you, Susan. Thank you, Louie. You want to close us out?
Thank you. Thank you for having us, and thank you for being so responsive. I just wanted to end with, I love quotes, and I was at a Martin Luther King celebration at St. Andrew's Church in Northeast Portland this January, and one of the members introduced the recognition they were going to give with a quote from Martin Luther King Jr. Faith is taking the first step, even if you can't see the whole staircase. And I've been so discouraged at times about whether we're making progress or not. And I thought, yeah, we can't see the whole staircase. We don't see how this is all going to play out, but we have to just, keep focused and keep working on it. And so, yeah, I just wanted to share that because it was helpful to me.
Thank you, Susan. I love your stories and your quotes. Appreciate you you being here. Hey. Yeah, thank you very much. So I think, who's leading this? Oh.
Please send our love back to the rest of the team, Susan.
Yeah.
Next time, we want all of you here. Okay.
There we go. Yes, so Matt, I think you're going to kick us off for the template.
Sure.
Could we put up the slides, please? Thank you.
Great. So, yeah, I've been asked to this is kind of a set the stage and then turn it back to Metro staff on this. One of the comments Nui made is actually a really important intro to this next bit, and that is the difference between the Oversight Committee and committees, similarly the one that Steve co-chairs for the bond itself, and what we do here at TCPP. And I think it's really important to have that background as we go to these next topics. Oversight committees, by their very nature, look at what has been done, the local implementations plans, for example, and decide whether or not it fits, what guidance they can give, and so on and so forth. Our task is different. We are a creative. We co-create, has been our task. We're in the process, obviously, strategic plan and co-create game plans for regional alignment and capacity building and data and all of these other kind of things. And to that event, we have identified 6 items that are, the areas that we want to begin with in terms of components of our strategic plan. So to be clear, this is not a statement that they are the only ones. Mike Liu made the comment, and I think he was right on a couple meetings back, of, well, wait a minute, there's other things that we also need to look at that would be part of it. And that is true, and we will need to proceed from, to those. But during this past year, as we've gotten ourselves organized and up and running and all that, we have developed these 6, and it's way more than just the one sentence that's in the slide. But it's, we've got the statements and the goals and all that kind of stuff, I think, in pretty good shape to be able to be taken and turned into actual programs and components. Now, with that, what we have done, and again, a reminder from something that's been kind of an underlying theme throughout, is that we are developing our strategic plan in component parts. And that doesn't mean that they are not, as I say, it's not going to be all of them all at once, because that just would not be practical. We'd never get it done. But we can do the components, so we have 6 components in the kind of on the runway. So during the next number of months at our meetings, Metro will be bringing to us game plans, updates, things of that sort that will relate to these 6 items. Today, what we're going to do is look at how the templates will be structured. It's not very complicated, but it's very important that we understand it and understand it fully. And again, I realize most people are just seeing it for the first time. So if you have other thoughts afterwards, please let us know. It's not asking for this to be carved in stone, but we are going to use these, subject to the conversation we'll have here in a moment, as the methodology. And then with that, the other thing that this will enable us to do, there's a reference also in the prior conversation to the various different kinds of funding approaches and so forth. We have responsibility for the Regional Investment Fund. It's, something the counties can deal with under the IGA until such time as we, put our plans in place. But I think this opportunity as we move to the next stage gives us also an opportunity to begin to identify aspects of the RIF that we would like to particularly focus funding. For memory, it's 5% of the collected revenue. And because the revenue has been much higher, that's really quite a chunk of change. It's probably somewhere between 17 to 20 million a year. And we have responsibility to help guide that, working obviously with Metro and the counties and all that kind of stuff, and then getting approval from the Oversight Committee. So it's a little bit of a convoluted process, I acknowledge, but I think it is something that we can begin to do. So let me close with that. And turn it back over to, I'm going to guess, Valeria, and so forth. But I will say, this is, to me, a very exciting inflection point. We've spent our first year getting these things in place as to the goals. I think the 6 we've picked are really good. Biased, obviously, as I suspect we all are. I know there will be others. But this is an opportunity to turn these goals into reality, working with Metro and the counties, and really creating something that will have a positive impact.
Yeah, thank you, Matt. Valeria, jump in.
Thank you. Thanks, Matt. Yes, so what we are coming to present to you today is, as Matt explained, each one of these goals is going to be a chapter in the regional plan. And this is what we're proposing as the structure for each chapter. We expect that this structure will go through iterations over time. I'll just list them off, but what we were proposing is we start with the regional goal, we provide some background about the issue that this goal wants to address, share the TCPB recommendations or approach, considering a racial equity lens questions, and also oversight committee recommendations and alignment, move to strategies, work plan or program description. Again, because each one of these goals is so unique from each other, we want to be as flexible as possible to potentially change slightly and modify it as needed. But I do believe that most of them will include also a timeline, a budget, and some metrics. Just to reiterate, this body was tasked with identifying regional goals, strategies, and outcome metrics related to addressing homelessness in the region. So we hope that this list provides very high-level categories for this chapter structure. And yeah, what we ask from you is to see if there's anything missing. It just looks right. Again, this is one of other documents that is building a foundation that will continue to expand and be iterated over time.
Great, thanks, Valeria. So let's open it up. I think Valeria just previewed the questions, and Matt previewed the questions that we're asking folks to reflect back on. So put your imagination hat on as you think about our recommendations. And if you imagine reading this as a chapter and seeing these headings, are they the right headings? Is there anything missing? Are they high level enough? Are they good to go? Mercedes, jump in.
I think this is pretty comprehensive, and I can imagine the work kind of filling in. The only piece that I think I would recommend is something that identifies who the partners are. I think we oftentimes just say the counties, right? The counties are huge. Sometimes it's multiple departments, a single department, an internal team. Sometimes HealthShare, it sounds like, is also going to be a partner in some of those. And so I think just having a little bit of insight into who were the players at the table.
That's a great recommendation.
Great, thank you.
Thank you so much. That's a great.
And you see that as its own heading, right? So it might be partners, stakeholders, players. Is it partners specifically, Mercedes? Is that the heading?
I don't know if I want to be as picky as saying it has to be its own heading. I think it can be at the discretion of the staff as they're putting it together. So maybe, because like one of these has, oh shoot, I lost my thing I was looking at. Like the way the considerations are kind of a sub-bullet, like if it ends up being a sub-bullet, I think that's fine. But I do, and I don't know if you want to call it partners or like who's leading the pieces.
Yeah.
I think kind of, what do you call yourselves when you're at the table, right?
Yeah. I'm seeing head shaking from Metro staff, so I think it's clear what you're asking for and how it fits in structurally. We can come back to Matt.
Yeah, I'm not quite sure if this is a separate edition, but one of the things that I think it becomes very important is that we include measures of success. And that's kind of implicit in some of the stuff that's there, but as I've thought further about this, my instinct is that it would be really good to do that, because then the other thing that does is it enables the oversight committees to be in a position to look at it from that standpoint. And then I think it also helps in terms of our communication strategy, because as we succeed, because we will succeed, then we can spread the word and say, look, this is what we intended to do. Here's how we said we would measure it, and look what we've accomplished. And I think that might be helpful. So something to consider.
So, Matt, just a follow-up question. So right now, the bullet is metrics, and what I hear is maybe a recommendation that says we should be talking about metrics as measures of success, and metrics would be the things that we're defining in that measure. Okay, thank you. Other thoughts or reflections? What's missing? Are these the right categories? Do they make sense? Nicole, there it is. All right.
I think also on metrics, both pre and post intervention, so that you can actually track where you started from, and maybe that's going to be in the regional issue background is data specifically on those metrics, but I would love to see that.
Yeah, thank you.
Let me see here.
Oh, Yvette.
Hi there. It just when you were discussing about the measures of success, I also think that challenges is important too, because as we go through, the timeline, we can see like, okay, there was a challenge here, but we were successful, or it's still a challenge and we're still working through that. So I think it's important to hear, the challenges, where we weren't successful and where we were.
Yeah, Valeria?
Yes, to that point and what Matt brought up, part of the responsibility of this group after some of these chapters have been approved is going to be monitoring. So specifically, I think in the charter it mentions provide guidance and recommendations to the counties on implementation of these strategies, and monitor and provide guidance on the implementation of the regional plan. So thank you for bringing that up. But that is to say, you will have an opportunity to weigh in as these goals are being implemented over time.
Thank you for that, Valeria. So Yvette, maybe I want to come back to you because there's kind of the challenges that you learn post-implementation as you're monitoring, and then there's the potential of naming challenges as potential risks or potential challenges as part of your pre-implementation analysis. And so Yvette, are you talking about both, or are you talking about more of the evaluation after the work's been done?
Both.
Okay.
Mm-hmm.
Patricia? Yeah.
I would expect that we touch on those challenges within the regional issue background category, but we can make a note to add that.
Yeah, and I think, to the first point that was made around where it lives, I mean, I think staff can determine, right? But you have a recommendation from Yvette to say, let's name where those risks or potential challenges might exist, and we'll leave it to you all, whether to embed it into an existing category or whether to add it. Matt?
Yeah, I mean, one way to look at that, which is pretty standard, is to put it in the context of what's often called a SWOT analysis: strengths, weaknesses, opportunities, and threats. And that's a great, setup for kind of the pre-measure of it. And that could be something, for Metro to consider as you go through and design these things. If you do a SWOT analysis and then report that out, it helps clarify what it is that we want to do in a lot of ways, but also what might stand in our way and how we might be able to overcome the obstacles.
Yeah, and again, I think that's, thinking about whether that falls into like part of the background is that SWOT analysis. But again, I think for today, we're capturing kind of what do folks want to see? And it sounds like some of these things can fit under the high-level categories that are on there.
Yeah.
Thank you, Matt.
Thank you.
Any other thoughts, reflections, things that you'd want to see? Whether it's a heading or whether, to the point we've been just discussing, whether it's a concept or I'll just say a concept that you want to see embedded into one of these. Poor Ariella over there. I don't know if the mic is picking it up or not. So there's a couple things that I'll just reflect back, right? So we heard a little bit about kind of the partners or players, stakeholders, whatever language ends up being, kind of measures of success being kind of a different heading than metrics, but metrics being underneath there. Really thinking about, the pre and post kind of evaluation and thinking about it in both ways. Finding a way to embed challenges as both part of what you're maybe using a SWOT analysis to think about those risks or threats in that model, but certainly also including that in monitoring. Was there anything that I missed, or is there anything folks want to add? Okay, not seeing any. Our folks, I think Metro staff, is there any questions you have based on what you heard?
No, thank you so much for your feedback.
Okay. I think that's it for that agenda item. So I guess the closing and next steps, our next meeting's August 9th will be, my note says healthcare systems. All right.
That's part of it.
I feel like
We'll have more than one agenda.
there'll be more than one agenda. Our next meeting's August 9th. Ebony and Matt, I want to give you a chance to say any parting words, and we'll wrap it up.
Hydrate, hydrate, hydrate. Yeah, just look out for each other and please take care of yourselves. And I'm glad that everybody was able to make it today. And I will see you all next time, or hopefully before.
Thank you, Ebony. Matt, any last words?
What the nice lady just said.
Yeah, drink your water, drink your water. And yeah, look at that, Matt being complimentary to Ebony, I appreciate that. Well, on that note of compliments and hydration, it's 5:41 for the first, at least on my clock, for the first time, I think, we're ending earlier than ever, so we've set a record. Oh, yeah, well, when I was, well, first time I've been able to get us through this, that's true. Well, we'll call the meeting adjourned. I appreciate it. What a wonderful conversation. Be well. Thank you for joining.